A 5-year-old boy has become Taiwan's second case of MIS-C after a COVID infection. MIS-C, or multisystem inflammatory syndrome in children, is a rare but potentially fatal complication in which the heart, lungs, brain, or other organs become inflamed. Doctors say children should be monitored for MIS-C within 6 weeks after a COVID infection. Signs of the condition include a persistent fever, accompanied by gastrointestinal problems or a skin rash.
Taiwan has reported another case of MIS-C, or multisystem inflammatory syndrome in children. It involves a 5-year-old boy who was diagnosed with a mild COVID case in late April. After undergoing 3 to 4 weeks of home care, he developed a fever that persisted for 7 days. He also experienced symptoms including bloodshot eyes, stomach pain, and diarrhea. After being hospitalized for 5 days and receiving high-dose immunoglobulin treatment, he was able to mount a recovery.
这个病人在当时时候已经出现了心脏的这些伤害。
This patient was already showing signs of heart damage as well as myocarditis. He also had blood clotting abnormalities of the hematopoietic system. In addition to that, he had gastrointestinal problems.
According to physicians, MIS-C mainly occurs in children aged 6 to 12. Overseas data indicates a fatality rate of 1 to 2%. In the 6 weeks following infection, a child who develops a persistent fever accompanied by gastrointestinal problems or a skin rash should receive medical attention immediately.
国外经验就是差不多3000。
Overseas, 1 in every 3,000 COVID patients is diagnosed with it. Here in Taiwan, if we are aware and vigilant, I think that we'll be able to provide early treatment and reduce the rate of diagnosis. Right now, there are people saying that we can bring it down to 1 in every 10,000 COVID patients.
The doctor reminded parents that shivers and convulsions are different symptoms and that there are a number of ways to identify the difference.
发烧前会发冷。
Before a fever, there are usually chills. The child will tremble all over. Sometimes they will have shivers, which can be confused for convulsions. However, convulsions are not followed by a fever, and sometimes after convulsions, a child will become lethargic and can't be snapped out of it.
The doctor also warned that in the case of infants under 3 months old, parents should rush the child to the emergency room if a fever occurs, regardless of the perceived cause.